Good afternoon, everyone, and welcome back to Conversations from Stritch. We are excited to be with you today. I know for many of our students and faculty, it is our miniaturized spring break, but we're excited to have you. Just a few announcements as we begin today's show. I think everybody in the country, and certainly people on Lewis's campus, are aware that yesterday Congress passed the American Rescue Plan, which is a $1.9 trillion federal spending package to address ongoing issues related to the pandemic and COVID-19. I think it's important for our community to know that in the legislation, higher education was allocated a little under $40 billion, which will be distributed to students and institutions based on a formula that has been used in some of the past emergency grants for the country. And our students, many of those who have received previous grants because of their financial situation, this will help us to continue to help them out next fall. I do want to just notify everyone, many of our students who received this email are aware of this, but just this week we notified about 2,000 of our students that they were going to receive, they are receiving an award from CARES Act 2 funding, which was passed by Congress in December. Students were sent an email. They have a choice to either apply the funding that they're receiving through CARES Act 2 directly to their bill, or if they don't get back to us or we don't hear from them by March 15th, then they will receive that in a direct deposit in whatever account they have on file with us. So students were awarded these awards based on their financial need. So I do want our students to also know that not every student is receiving an award, but those students who have faced financial pressures due to the pandemic will receive those awards. And as I said, this new bill that passed yesterday will not begin to impact students in terms of getting another award until next fall semester. So just so people are aware of, this one is behind. It was finalized in December. We're giving it out in March. Some of the same thing will happen in terms of the moving on. So I'd like to turn it to Chris to talk a little bit about where we're at academically, because we're in the midst of this academic, and then there's new stuff coming along with COVID as well.
Great, thank you. Great to be with everyone today. Yeah, this is the middle of the term. Our small spring break is the midterm marker, and so it is a time for this short, safe break, as we've talked about before, and also a time to reflect on how classes are going up to this point. For faculty who are watching, midterm grade reporting is really, really important opportunity to notify our academic services and the registrar about how students are performing in classes, identifying students who may be struggling, and we know that there are so many challenges that students have right now. We want to make special care to make sure that faculty are doing that midterm reporting so that we can be as proactive as possible with supporting students at this crucial midpoint in the semester. So please review that email that was sent out by the registrar earlier this week and follow the instructions that go along with that. And thank you for doing that. So a few things about COVID-19, updates related to COVID-19. The Centers for Disease Control announced its first set of recommendations on activities that people who are fully vaccinated against COVID-19 can safely resume. The new guidance includes recommendations for how and when a fully vaccinated individual can visit with other people who are also fully vaccinated and so on. And we're really excited about this new guidance. And our Lewis COVID-19 hotline team is reviewing these guidelines and will make recommendations in future weeks about how we will alter our policies in connection to them. But just to be really clear, until further notice, we are still following the guidance for non-vaccinated and vaccinated individuals in public settings. Wear well-fitted face coverings, stay 6 feet away, avoid medium and large size in-person gatherings, and get tested if experiencing COVID-19 symptoms. And then continue to follow those guidelines. A reminder that for those of you who are traveling, please consider quarantining for 5 to 7 days after your return, even if you have tested negative. Try to restrict higher risk activities for 2 weeks if you feel like you've been in any kind of concerning situation. Consider any symptom, even an unusual headache or fatigue, as indicating a possible infection, and seek testing if you have any concerns. We will be doing testing on campus next Thursday, March 18th, from 9 to 11:30 a.m. And if you would like to request an appointment, please contact the COVID-19 hotline. All of those announcements will come out on an email from me today. A couple other things going on campus we wanted to share. Again, a reminder that the current art show is up, Women in Art at the Field. Really great show. We're so excited about people seeing. It's open through the end of next week, and the virtual talk will be broadcast on March 18th, next Thursday. Our studio theater, our Black Box Theater, will present The Guys by Ann Nelson on Friday and Saturday next week. So please get tickets for that. It's directed by a Lewis alum, Mike Frail, and tickets are available through the Philip Lynch box office, just like you would buy tickets for our Philip Lynch performances. And then finally, we both attended last week a virtual ceremony of the Gamma Chi chapter of Delta Epsilon Sigma, a distinguished honor society focused on Catholic universities. And we just want to again congratulate the students and faculty who were admitted. 11 students and faculty combined were admitted into this induction ceremony, which was the 56th annual ceremony. It's a really great organization, and we're so glad that more students are entering it. Students have to have completed at least 50% of the credit requirements for their bachelor's degree, and have to be nominated with a GPA of over 3.5 and a nomination from faculty. So it's a pretty high bar, and so we're really excited to introduce these students: Amanda Doran, Sarah Markin, Marek Spader, Jacqueline Burry, Laura Lee Hand, Marissa Kmedi, Jennifer Mahorchik, and Asenia Saldivar. And then faculty members Gretchen Hoag and Christopher Klein were also admitted, and Tom McNamara were also admitted into the society last week. So congratulations to all of them. A team of Lewis computer science and cybersecurity students competed last week in the Atlantic Council Cyber 912 competition. This is something I know that happens every year, and it's an event. This year it was held in Washington, D.C. and online, and they hosted 33 teams across the United States from different universities, and the students engage in scenarios related to cyber attacks and construct responses to those cyber attacks. And our team, consisting of Jocelyn Murray, Andrew Milligan, Ryan Syed, and Aiden Pfeiffer, all competed, and they made it to the semifinals, which is amazing, and also got an honorable mention for social media engagement in the event. So I'm going to turn it back over to you, Dr. Livingston, for some athletic updates.
Thank you, Dr. Stent. Again, we're just, and this goes with athletics as well. We're such in the midst of this semester with so many activities going on. We had a couple really nice victories from the men's and women's tennis team against Michigan Tech earlier this week. They played on Tuesday, and that was great for them to get back in the winning column. They had a tough loss last week, but bounced back. And I got to say, we're so incredibly proud of the men's basketball team. They defeated Drury last weekend in an amazing game. We talked about looking forward to that game, and then they won that game on Sunday. And we're really excited because what this means, I think many people are aware because they're maybe playing their bracket themselves on the Division I level. You win your conference tournament, you get an automatic berth into the NCAA National Championship Tournament. So our men's team left campus today. They're heading down to Southern Indiana, and we'll be playing down there on Saturday. So please take a look at that. You can watch it from your device. In addition, this weekend, I think we have about 15 different contests going on this weekend. that everybody should be aware of, and please take some time to look into that. The other really exciting thing on the national level is 3 of our flyers on the indoor track team. Outdoor track is just getting started, basically in the next couple weeks, but indoor track is wrapping up its season. So 3 of our athletes are competing starting today and running through Saturday. Alicia Cardio and Anna Ladizio are competing in the triple jump. This is on the national stage. And then Jada Hoffman in the 60-meter dash. So excited for them. This weekend, and I'm not even going to list off all the things that are going on this weekend, but trust me that there is just about everything you'd want to see this weekend with contests happening, a lot of them on Saturday, some on Sunday. But if you want to watch some athletics, you can see just about anything this weekend. Just a reminder for everybody before I turn it back over to Dr. Sent that we are competing in both our fall seasons and our spring seasons at the same time. That's why if you go to our website and look on athletics, you're going to see both soccer teams and lacrosse teams competing at the same time. Because we're trying to get everybody in and we couldn't do any of those contests this fall. So now we're excited to introduce our guest for today. So I'll turn it back over to Dr. Sent with our guests and some really great, it's stuff we're so proud of when our students and our faculty are involved in the community.
Yes, that's so true. And we have spoken a lot on Conversations from Stritch about the incredible work done by our faculty, staff, and students in the community in connection to COVID-19 over the year in so many different fronts. And we're so proud and grateful for the service that our community has done. But no group has been more committed to service, often under dangerous and challenging circumstances, than our community of nursing faculty, students, and alumni. So on the eve of the anniversary of our closing of the campus due to COVID-19, we wanted to devote some time to appreciating our nursing community. So we're going to have 2 guests. I'm going to and they are Dr. Julia Koklys and a student, Elisa King. I'm going to introduce Dr. Julia Koklys first, and then we'll bring on Elisa. So Dr. Koklys is the chair of the Department of Nursing. She is a family nurse practitioner and maintains an active clinical practice. She is on the board of directors for the Illinois Society for Advanced Practice Nursing as the government relations chair, and is actively involved in legislation surrounding nursing practice at all levels. Her research includes an interest in nurse practitioner transition to practice and readiness for full practice authority. So welcome, Dr. Koklys. Great to be with you.
Thank you.
Thank
you very much, Dr. Sent.
Yeah, thank you so much for joining us.
Yeah, it's great to be talking with you, and I think I know you have maybe some prepared things to say, but I think the first topic is probably just asking you a little bit about what you're hearing from colleagues in the nursing community and from alums, and kind of about what this year has been like in general in the profession.
Well, I think the primary thing is it's an ever-changing environment. We started the year with a lot of unknowns, and throughout the course of the past 12 months, we've learned a lot more about, public health and, transmission of infection and how we can prevent things. It's been definitely a challenge for people working in the nursing and in healthcare professions in general. It's been a taxing year, and I'm just thrilled and impressed and proud to be part of the community of nurses and healthcare providers associated with Lewis.
So, Julia, could you talk a little bit about what has changed in our program, like in terms of the curriculum, clinical settings, those kind of things that has changed because of COVID? I think in some sense, probably some of our nursing students have received an education that we couldn't have imagined being able to give them, and on other levels, they might have had some limitations. So could you talk a little bit about how COVID's impacted teaching and learning?
I think Julia
Certainly.
might have a visual.
Oh, did you want to?
Okay, yeah, this might be a good time for that.
Thank you.
But go ahead, yeah.
I can start talking, right. So, starting a year ago, we knew there were going to be necessary changes, and thank you to the university for the support to help faculty and staff make these changes, the support of this, for the students as well. We had to convert all of what traditionally were on-ground courses into online courses. And it required a lot of time and effort on the part of the faculty, a lot of flexibility on the part of the students, but we were able to quickly, in a matter of weeks, turn what were, in-person classes to online classes. That was primarily affecting the undergraduate students. We had, the graduate students typically had a good portion of their coursework is already online, so they were less acutely affected at that initial stage. Our lab courses for the undergraduate were all shut down, so we had to transition quite a few of those courses over to virtual events, virtual simulations. The students had to go online and do their simulation activities. That was initial. We've been able to fortunately bring a lot of students back on campus now in smaller groups. Our lab coordinators have done an amazing job putting the simulation events together. We were able to bring students into the labs to have in-person, education again with the appropriate spacing, the appropriate protective equipment. So not everything has been virtual or simulated. We had to bring down class sizes dramatically. That really did affect primarily the labs as well as the clinical placements for the undergraduate students. What used to be a group of 10 students on a unit is now 5. So it changed how we delivered the education to those clinical groups. And then again, for our graduate students, we had a number of agencies that just basically for safety reasons for both their staff as well as students and the lack of personal protective equipment, they shut down completely to students. So for a period of time, we did have students that were unable to attend clinical at all. With that, we were affording students extensions, because of a lot of the illness, with students' families, with having to provide care for their children because their children weren't in school. We were able to do a lot of accommodations for students with regard to their classroom and their clinical. The next slide, please.
Mind if I ask you one other thing about what you just said before we
Sure.
turn to vaccination? I'm just curious.
Sure.
We're often talking about how we're learning a lot this year, and we're doing a lot of things we didn't want to do, we didn't intend to do, and you just described that so well. I just wonder, maybe I'm thinking particularly about the simulation labs or something like that. Is there anything we're going to take into the future, that we accidentally learned this year through the conditions that we're under, or just any learning from this experience?
Sure. We had to get a lot more simulations up and running faster than I think we would have had we not been forced to. So I think we're going to continue that going forward, especially for the graduate level. The graduate students have to have a very specific number of direct patient care experience hours, whereas undergraduate, it's a little more flexible. So I think we'll continue with that going forward. Additionally, I think we've learned that it's acceptable to be a little more flexible with clinical practice hours. It doesn't have to necessarily be, as prescriptive as we once thought. So I think we'll continue with that as well.
Yeah, and what's amazing to me, Julia, is just to congratulate you and the whole team, and of course the students. The NCLEX pass rate of 97, one of the highest in the state, done in the midst of COVID times. So I don't know if you could speak to that just a little bit about, what that says about Lewis's nursing program.
I say this anytime I speak. I'm a graduate of Lewis's baccalaureate program. I'm also a graduate of their doctoral program. So I'm a big fan. I think Lewis has an amazing nursing program, and we definitely have that reputation in the community. It shows with our pass rates. Even despite a global pandemic, we have continued to provide quality education. We have, faculty that are willing to bend over absolutely backwards for our students. and students that are resilient and able to learn despite whatever life throws their way. So I think it just speaks to the quality of student and faculty that we have here.
Yeah, thank you. So, again, congratulations on that. And just, it is a testament to the faculty and students and the resiliency that all of you have shown. And it's not as if this is something new to Lewis. We've been very good on our NCLEX pass rates for years, as you said, as a student of the institution, a graduate of the institution yourself. Chris, do you want to? I don't know where we're at in terms of.
I think I do.
Okay, you go ahead.
So we just we'll ask you, Julia, before bringing Alyssa on, just tell us a little bit about what we've been doing around vaccinations and how our faculty have been involved and how our students have been involved, and then we'll ask Alyssa to join us.
Great. So first of all, thank you to Dr. Nancy Ryland, who has really spearheaded the efforts for Lewis University with regard to the vaccination and everything that is COVID. She's been integral in all of this, and she's provided me with some great data. So the vaccination, efforts started back in late December, so right after Christmas, and they started with a few faculty supervisors and a couple dozen students. That first week, they provided about 500 vaccinations over that first week. And each week since then, we've had up to 6 faculty and up to 24 students, and then at multiple sites, and they deliver anywhere from 200 to 1,000 vaccinations each week. So it's a great impact from our students and faculty. We're working on-site at the Will County Health Department every Thursday. They help with many off-site events. Will County First Student Bus Drivers, Frankfurt Autism Group, an IAG Advocacy Group, Plainfield and Frankfurt EMS, Shanahan School District, and more. And they've offered support to the Kendall County with 2 days of max vaccination clinics and Yorkville High School. They're also doing Oswego High School this weekend and again in April. And in the future, we've been asked to help plan and implement several clinics on our campus, 2 with OSCO to assist with the 1A and 1B vaccinations. And they're looking at about 1,000 doses a day with those. And now they're planning an event in late March to assist adults with special needs and their caregivers. So our faculty continue to fill the slots that are needed in the clinics, volunteering their own time to provide vaccinations to the populations that need to be vaccinated. So we have definitely made a great impact. Thank you to all the faculty and students.
Yeah, thank you so much to all of our faculty and students who participated. It's really nice to just listen to you name all of those different organizations and populations that our faculty and students have been serving over these last couple months. So it's just really powerful, and again, just such a great thing that we've been able to be so proactive in our contributions to our community. So I think we would be great to ask Alyssa King to join us. And welcome, Alyssa.
Hi.
I know you're out there.
Thank you.
Great to be with you. Thank you so much for agreeing to be with us today. So I guess I just want to ask you, since we were just talking about vaccinations, can you want to tell us a little bit about what your role in that has been?
Yeah, so as Dr. Coates had said prior, I actually did get an email about volunteering for a vaccine clinic at the end of December at Will County Health Department. And I was super excited about that, and being able to go there and be in that environment where everyone's just really uplifted, and definitely in a time where we've been quarantined and been so separated, where we can now come together to be vaccinated and really, try to put a stop and end to this pandemic. It's just overall super uplifting. It's, super great, just overall, just to be able to help out. And I know we definitely overall in the efforts to get every single person vaccinated, we're really just putting a small dent in the overall number, but it is still so nice to be able to help out and being able to contribute, my time and efforts. And yeah.
So Alyssa, can you tell us a little bit about where you're at in your kind of academic journey? So yes, you've it's great that you've been doing these vaccines, and obviously you and other students in our nursing program were asked to help out, and you were more than willing to do it. But kind of your year, maybe where you're from, and what drew you? We were just talking about how great our NCLEX pass rate is, but what drew you to decide to come to Lewis for your education?
Yeah, so my name's Alyssa. I I live in Orland Park, so I do commute, and I'm a senior in the program. So I am graduating in May, so about 8 weeks. And something that really drew me to Lewis is that it's really close to home, and it's a school that I could commute to really and still get a great education. And I think, in this, just with everything going on with the pandemic, it's just been really nice. And I feel like the College of Nursing has really made an effort to be able to get us into the hospitals when we can. Because I have heard from other students from other schools who have not been able to get that clinical experience that is really invaluable to the education.
And so if you had to decide, or I mean, if you get to decide, and I think many of our graduates of the nursing program kind of get their choices, but do you have an area that is really interesting? Like, do you like the OR? Do you like working on a peds unit? Do you want to work in a hospital or in a office setting? What's your where do you want to be 2 years from now or a year from now?
Yeah, I'm really interested in the tele floor. So basically working with patients who have like any cardiac abnormalities. So yeah, definitely looking in the cardiac area and department there. So
That's
That
great.
sounds great. And I'm sure you'll make a big impact in that area. I guess I want to ask you a little bit about some of the things that Dr. Koklys was talking about in terms of how this year has been different, and just tell us a little bit about how it's been for you, maybe compared to last year in terms of the classes and the labs and you mentioned the clinical placements a little bit, but maybe reflect a little bit more on that.
yeah, so really, prior to the pandemic, we were all in the hospitals, and then, the pandemic hit. And at that time, I was in a labor and delivery clinical. So that clinical had to be online more, it was just more of a face to face. We did, case studies, and it was still a good experience. I learned a lot from my instructor, but of course, we did miss out on that, clinical, face to face instruction. But definitely moving on to last semester, we were able to get in the hospitals. I had a med surge 2 clinical that at Christ, so we were able to get into the hospital there and get that experience. And then we did these second 8 weeks of the semester, I did have a psych clinical, which was online. But now we utilize a program called ATI, which overall was a really good experience because we were able to, it was more of like a virtual like reality kind of, you get to kind of decide maybe what are the options to pick as the nurse in the role, and you can see them play out. So it definitely was a better experience as far as a clinical online, and I did learn a lot from that clinical as well, even though it was online.
Wonderful.
That's great.
Well, I have a question for both of you, and I don't know quite how to ask it. As we've been talking about, the profession of nursing is so much in the news. There are, for very, I guess I'll use the word heroic reasons, and also for very challenging reasons. We've just seen so close up, so many different people in the profession going through such a hard year, and also such a powerful, rewarding year. And I'm just, or the community, there's so many people in the country, across the world, are seeing what an incredible profession it is and what an impact it's making on society. I'm just wondering if you think that's sort of a negative and a positive thing in terms of do you think there'll be more nursing students, or are there people out there who are experiencing this and saying, I want to be a nurse because of what's happening, or maybe stepping back a little bit? I don't know. That's my thing. I'd like to hear you talk about, or reflect on. Dr. Koklys, maybe you go first.
Sure. So yeah, Dr. Sint, I think that's the question on everyone's minds right now. And I don't know that we have a good feel for what's going to happen in the next year. I think, yes, I've heard both sides of that story. I've heard families that say, oh, I don't want my child to go into nursing because of this. And then I've heard people say, oh, this has made me want to go into this profession more. The pandemic has really accentuated and highlighted the service nature of this profession, and that nurses go where needed. We don't get to pick and choose. So I think it's one of those time will tell things. As far as the graduate students, I mean, if you look at our enrollment, it's going up. So I think from a advanced practice and graduate level education, I believe we're going to see more students enrolled.
Impact since you brought up graduate students, any specializations or areas of focus in graduate programs?
We're seeing a lot of increase in our psych mental health nurse practitioner program. And in that same vein, I think what the media has done surrounding this pandemic and the nursing profession has highlighted the importance of care, self-care, the importance of seeking treatment when needed for trauma, for post-traumatic stress disorder. We're going to see a lot of that in our future. So that program has really increased.
And Alyssa, I guess the same question to you. Do you feel like if a cousin or a family friend came to you and they were a senior in high school or a junior in high school and were saying, so you've been through a lot with this, should I still consider being a nurse? I was planning on being a nurse, but all this COVID stuff scares me. What would you say to, or have you had people come to you like that? Somebody in your family or friend from church or whatever?
Alyssa and I were kind of talking about nursing pathways before we got on the call today. And, nursing is not just bedside. And that's one of the things that has really been highlighted during this pandemic is the nurses that are at the bedside, in the ICUs, in the hospitals. But that is not all that is nursing. So it's definitely a career path that has endless opportunities. So I would certainly encourage high school students to go into nursing, despite a pandemic.
And Alyssa, do you have any insights on that?
Yeah, so I mean, actually during the summer, my sister, she was at home a lot. She lives in California, but she was at home a lot due to the pandemic. And she asked me, we had a conversation, and she said, does this scare you? Like, because you're going to be a nurse, and like, how do you feel? Like, do you still want to be a nurse? I'm like, well, of course, and Dr. Coates had stated, it is just really about, being safe and making sure you do have that PPE. And I think overall, this pandemic has really created a platform for nurses to advocate for themselves and to speak up about patient ratios, and making sure that they're providing a safe environment to give care. And I just told her, you just have to stay safe, make sure you have that PPE, protect yourself, do some self-care. And overall, if you don't protect yourself and if you don't take care of yourself, then you can't care for others. So that really is important as well. So
thank you.
That's such a great reminder. Yeah. I wanted to maybe bring up one more topic before we close. Last week, we announced a significant grant for Lewis to be a telehealth hub for speech language pathology, occupational therapy, and clinical mental health. Julia, could you tell us a little bit about how the nursing profession is negotiating telehealth and what we're doing around that? And you mentioned it already a little bit today, but I think there's probably more to say.
There is quite a bit more to say. The grant was received by our speech language pathology department in conjunction with another department. I'm sorry, I'm not terribly familiar with the grant, but they are looking at, interdisciplinary telehealth opportunities. And this is a nice segue for an event that we are hosting in a week, I believe. This is an event that's hosted by our Sigma Theta Tau Honor Society of Nursing, and this is a free event for anyone that's interested. And what it is really talking about is the rise of telehealth in healthcare right now. And it came to the forefront in the recent months and years or year because of the COVID pandemic. You know, as a clinical person in clinical practice, my seeing patients came to a halt, and it became me seeing a patient just like this. And it does require a different approach, frankly. So the event will be on Wednesday, March 24th. It's from 6 to 7 p.m. Sorry, 7:30 p.m. And there are CE credits for nurses or nursing students, and it is free. And what we'll talk about, you know, what happened, how did telehealth come about, and then I'm going to go through with the group how to conduct a virtual visit. So a virtual visit with a provider, what it should, or you as the provider, what it should look like. And then we're going to have a panel discussion with some of our nurse practitioner faculty that are in clinical practice about what their experience has been this year with telehealth. So it is definitely the wave of the future. I don't think it's going to go away anytime soon anyway. We've actually seen a great increase in our patients that are seeking psychiatric help. They are actually completing more visits via telehealth than they ever did before, because a multitude of reasons, but they can do it without leaving their homes. So it has increased access for a number of populations, in addition to being safe during a time where we couldn't, you know, be together in spaces.
Well, I want to thank you for doing that work. I think it's an exciting opportunity, you know, to do the continuing education for our community is just one more thing like the vaccines that you and your colleagues are doing. So thank you so much, Dr. Koklys, for that work, but also for joining us today. We're grateful, and for your leadership within the nursing faculty. And Alyssa, thank you so much for joining us as well. It's just been a great opportunity to hear more about nursing and all the excellent opportunities that it provides for our students and the broader community. So thank you both for joining us. We really appreciate it. And I hope you both maybe enjoy just a little break this weekend, even if it's just time to, I don't know, go for a walk or something. The weather's decent out there. So thanks so much for taking some time of your break and joining us.
Thank you.
So I think we're good. Dr. Sint kind of waved to me and said he doesn't have anything more to say. So we're going to wrap up the show. I do want to just mention that next week we're going to be talking about communications in the communications department at Lewis University, which of course includes this studio. So we're very excited to be able to have a little conversation with some of our students who are working behind the scenes today. I know Carl's in there today working, as he often is, and John Kilpatrick and Joe Glatz. But next week, we're going to also be joined by Professor Haley Miller, who's going to be joining us to talk a little bit about the broader communications field. But we'll get a little behind the scenes on what goes on behind us and next to us in the studio here, but also about all the opportunities in the field of communications in our contemporary climate, with so much going on in terms of our use of video technology to enhance our lives in a COVID climate that I think will stick around. So I think it's going to be a great show next week. Please, again, please stay safe. Take care of yourselves and those around you by making sure you follow all the guidelines. And many blessings to you and your family. Have a great week.